My name is Harith Akram. I'm a consultant neurosurgeon at the National Hospital for Neurology and Neurosurgery. My specialism is something called functional neurosurgery, which is a field of neurosurgery where we operate on seemingly normal looking brain, but dysfunctional networks. So patients with Parkinson's disease or with tremor or patients with pain. Well, I'm fascinated by how the brain works. And for me, neurology had presented this really interesting challenge because you need to have a knowledge in anatomy, knowledge in physiology, and pathology, disease process, to pinpoint what the problem is. But that alone didn't really satisfy me because I wanted to be able to then go in and fix it. And that's what neurosurgery allows me to do. It's also very satisfying in terms of uh, contact with patients. Patients who come in to see a neurosurgeon often have, they often have a lot of anxiety about seeing a neurosurgeon. So there is that responsibility, which makes it, really worth the while, especially when we get to make patients better. Uh, and that's incredibly satisfying. So one of the procedures I perform is something called deep brain stimulation, and that involves implanting electrodes in the brain, very thin electrodes that go in very specific areas in the brain, and then these electrodes are connected all under the skin to a computer and a battery pack, and they deliver constant electricity to these brain networks that are dysfunctional. And that works very well for conditions like Parkinson's disease or cluster headache, um, and similar conditions, dystonia, and tremor. I also do operations where I disconnect networks in the brain. So rather than implanting electrodes, we can make very small lesions or burns in the brain to, to disconnect dysfunctional networks. That works very well for conditions like tremor, for example, and we can do that at the National Hospital with either putting an electrode in, something called radiofrequency, thermoablation, or we can do it with focused ultrasound. That's another tool that we have. I also operate on trigeminal neuralgia patients. So rather than just do microvascular decompression, I can do radiofrequency ablation, I can do deep brain stimulation, I can do occipital nerve stimulation. And if all of those fail, then we can even move on to more kind of experimental procedures that, we do a lot of research at the National Hospital Neurology and Neurosurgery and at UCL to develop and advance. And what I do in my lab is translational research. So we get the cutting edge research and science that feeds back into patient care so we can tackle the most refractory and the hardest of cases. We're really fortunate here because we have a very wide range of very motivated and committed specialists that want to work together. So we don't work in silos. We see patients together. When I get someone coming with a problem, if it's a neurological problem, then I will see this patient with a neurologist. Um, if it's a cluster headache, headache problem or facial pain problem, then I see the patient with a headache neurologist. And that way, we can give the best service to the patient. That's the nice thing about working here is that it's not individualistic. You're not coming here to see one specialist. You're coming here to see a team, and that team will not just deliver a one-off treatment. No, we'll start from getting the right diagnosis, delivering the treatment, and then follow up and ensuring that the patient is supported, especially if we provide a procedure that involves an implant, for example, because that will need lifelong support. So this is one of the strengths of coming to the National Hospital.